Welcome to today's video about morning breathing problems that reveal hidden lung disease. Your alarm goes off. You open your eyes, take a breath, and something feels wrong. Maybe you need a few seconds to catch your breath after sitting up. Or maybe that cough you've had for months greets you again, right on schedule. You brush it off. Tell yourself, everyone feels this way in the morning. But your body is trying to tell you something serious. Morning breathing problems are not random. They're your first warning sign that your lungs might be in trouble. And the earlier you listen, the better your chances of doing something about it. If you're over 40, if you've ever smoked, or if mornings feel harder than they should, pay close attention to what comes next. The American Lung Association reports that COPD is now the third leading cause of death in the United States. But here's the problem. Most people don't recognize early symptoms until significant lung damage has already occurred. According to research published in Respiratory Medicine, morning symptoms appear in all stages of COPD, even the early ones. That means the signs are there. Most people just don't know what they're looking for. Everything you're about to hear comes from verified medical sources. No guesswork, just facts that could change how you think about your health. All right, take a deep breath with me. Here are the morning breathing issues that could be warning you about hidden lung trouble. Let's start with the first one. Morning cough lasting more than 8 weeks. A cough that wakes you up every morning for months is not normal. The Mayo Clinic defines chronic cough as one lasting longer than 8 weeks. Morning coughs are particularly revealing because they happen when your body tries to clear mucus that built up overnight. While you sleep, mucus accumulates in your airways. Healthy lungs clear this quickly and easily, but damaged airways struggle, causing persistent coughing that can last 10, 15, even 30 minutes after you wake up. Research in chronic cough studies shows that 70% of COPD patients experience regular morning coughing. The American Lung Association confirms that chronic cough lasting 8 weeks or longer is one of the most common reasons people seek medical care. Pay attention to what you're coughing up. Clear or white mucus suggests mild irritation. Yellow, green, or brown means infection or inflammation. Your body is actively fighting something serious. If your morning cough has continued for more than 2 months, document it and schedule a doctor's appointment. Next, problem 2, breathlessness when standing up. Do you find yourself breathing harder than usual when you first get out of bed in the morning? This is called orthostatic breathlessness, and it's more concerning than most people realize. Your lungs spend all night in a resting position. In healthy people, they re-expand easily when you stand. But when lung tissue is inflamed or scarred, that simple transition becomes difficult and noticeable. Studies on morning symptoms in COPD patients published in respiratory medicine journals show that breathlessness upon position change is common even in early-stage disease. Your body is working overtime just to handle a basic movement that should require minimal effort. This isn't getting older or being out of shape. This is a measurable change in how your lungs function. If standing up from bed consistently leaves you winded, even for just 30 seconds, your body is sending you a message that needs attention. Early evaluation can make a significant difference in treatment outcomes. Next, problem 3, chest tightness upon waking. You wake up feeling like there's pressure on your chest, like you can't take a full, deep breath no matter how hard you try. This is morning chest tightness, and it happens because inflammation in your airways intensifies overnight. While you sleep, your body produces less cortisol, your natural anti-inflammatory hormone. So any existing inflammation you have gets worse during the night. When you wake up, you feel it as tightness or pressure. Research from the National Heart, Lung, and Blood Institute shows that people experiencing chest tightness more than twice per week have a significantly higher risk of undiagnosed respiratory disease. The encouraging news? This symptom is often reversible if caught early. Many patients report noticeable improvement within weeks of proper treatment and lifestyle modifications. Ask yourself, does the tightness improve after you've been awake for an hour or two? If yes, that suggests manageable inflammation. If it lasts all day, that requires a different conversation with your doctor about more comprehensive testing.
Next, problem 4, wheezing or whistling sounds. A high-pitched whistling when you breathe in the morning isn't just congestion, it's your airways telling you they're narrowed or blocked. Wheezing happens when air is forced through restricted passages. Mornings make it worse because airway inflammation peaks during sleep hours. Research published in respiratory medicine journals shows that morning wheezing occurring more than 3 times per week is associated with undiagnosed asthma in about 1/3 of cases and early COPD in nearly 30% of cases. Here's what most people don't know. Chronic wheezing causes permanent damage over time. Your airways are lined with tiny hair-like structures called cilia that sweep out debris. Ongoing inflammation destroys them. Once they're gone, they don't regenerate. The earlier you address wheezing, the better chance you have of preventing irreversible airway damage. If you hear whistling when you breathe, especially in the morning, document how often it happens and discuss it with your doctor promptly.
Next, problem 5, difficulty breathing lying flat. You need 2 or 3 pillows to sleep comfortably now, or you wake up gasping in the middle of the night and have to sit up to catch your breath. This is called orthopnea, and it's a serious warning sign. When you lie flat, gravity no longer helps drain fluid from your lungs. If there's any fluid accumulation or reduced lung capacity, lying flat makes breathing much harder than it should be. According to Cleveland Clinic, orthopnea is often a symptom of heart failure or lung disease. It means your body is already working overtime just to keep you breathing at rest. The Sleep Foundation reports that orthopnea requires medical evaluation because it indicates excess fluid creating pressure around your lungs. Here's the key detail. If you've gone from sleeping flat to needing multiple pillows, that's not a sleeping preference. That's your body compensating for a real problem. This symptom matters most when caught early, before permanent damage occurs. Next, problem 6. Extreme fatigue despite full sleep. You slept 8 hours, but you wake up exhausted, like you barely rested at all. This isn't about sleep quantity, it's about oxygen quality. When your lungs don't function well, your body doesn't get enough oxygen during sleep. Your cells are essentially suffocating. You might be sleeping, but your body isn't recovering the way it should. The American Lung Association reports that COPD-related fatigue is caused by oxygen deprivation, reduced strength and endurance, and the extra effort required just to breathe. Between 50 and 70% of people with COPD experience extreme fatigue. Dr. Jamie Garfield, American Lung Association medical spokesperson, explains, fatigue is a daily lack of energy, lethargy, brain fog, weakness, and tiredness that is not relieved with sleep. Watch for these patterns. Do you wake with a headache? Does your partner say you snore loudly or gasp during sleep? These are clues you're not getting proper oxygen at night. Next, problem 7. Increased mucus production every morning. Waking up every morning needing to clear thick mucus from your throat or lungs might seem normal, but persistent morning mucus production is your lungs signaling that something is wrong. Your lungs normally produce 1 to 2 liters of mucus daily to trap bacteria and debris. But when airways are inflamed or damaged, they produce excess mucus as a protective response. Studies from the American Journal of Respiratory and Critical Care Medicine show that chronic, mucus hypersecretion, producing excess mucus for more than 3 months, is independently associated with accelerated lung function decline and increased risk of COPD exacerbations. Color matters here. Clear or white suggests mild irritation. Yellow or green indicates infection or inflammation. Brown or rust-colored could mean old blood and needs immediate medical attention. Your body produces excess mucus to protect damaged lung tissue. The real question is, what's causing that damage in the first place? Next, problem 8. Shortness of breath during morning routine. Brushing your teeth or getting dressed shouldn't leave you breathing hard, but if it does, you're experiencing exertional dyspnea, shortness of breath during minimal physical activity. Healthy lungs have reserve capacity. They handle basic activities without any struggle. But damaged lungs are already working near maximum capacity just to keep you breathing normally at rest. The Global Initiative for Chronic Obstructive Lung Disease identifies progressive exertional dyspnea as one of the primary criteria for diagnosing COPD stages 1 and 2. The early stages where treatment interventions are most effective and can preserve lung function. If you're experiencing breathlessness during activities that used to be effortless, that's not getting older. That's measurable lung function decline that can be documented through simple pulmonary function testing. The sooner you address it, the more of your lung function you can preserve for the future.
Problem 9. Blue or pale lips in the morning. If you or your partner notices that your lips look bluish or unusually pale when you first wake up, that's cyanosis. It means your blood isn't carrying enough oxygen to your tissues. Normally, lips are pink because tiny blood vessels near the surface carry oxygen-rich blood. When those vessels carry oxygen-poor blood instead, they appear blue or purplish. According to the National Center for Biotechnology information, cyanosis usually becomes evident when blood oxygen saturation drops below 80 to 85%. This represents a serious drop from the normal range of 95 to 100%. The Cleveland Clinic states that cyanosis in COPD patients indicates severely low oxygen levels and can occur with advanced disease, pulmonary hypertension, or during acute exacerbations. This isn't a symptom you monitor at home. This requires immediate medical evaluation and possible emergency care. Even mild bluish tinting matters. Your brain, heart, and every organ depend on adequate oxygen to function properly. Next, problem 10. Anxiety or panic feeling upon waking. You wake up feeling anxious or panicked and you don't know why. No bad dreams, no obvious stressors, just an overwhelming sense that something's wrong. Often, this isn't psychological at all, it's physiological. When your brain doesn't get enough oxygen during sleep, it triggers your fight or flight response. You wake up feeling panics because your body is gasping for air at a cellular level, even though you're not consciously aware of it. Research shows that up to 40% of people with undiagnosed sleep apnea or COPD report morning anxiety as their primary symptom. They often get treated for anxiety disorders when the real problem is respiratory. Here's the pattern to watch for. If you wake with anxiety that improves after you've been awake and moving for 30 to 60 minutes, consider that it might be respiratory rather than mental health related. Not all anxiety is in your head. Sometimes the root cause is in your lungs and oxygen supply. Here's what you need to understand. Most lung diseases are progressive. They get worse over time if left untreated. But caught early, many can be managed, slowed down, or even partially reversed. The problem? Most people wait. They tell themselves, it's probably nothing. They don't want to bother their doctor. But every year you wait, you lose lung function you can't get back. The American Thoracic Society reports that people who seek evaluation for respiratory symptoms within the first 6 months of onset have significantly better long-term outcomes than those who wait 2 to 3 years. Your lungs don't send reminder notifications. These morning symptoms are the only alerts you get.
Next, what to do next? If you're experiencing one or more of these morning breathing problems, here's your action plan. First, start documenting. Write down which symptoms you experience, how often, and how severe. Your doctor needs this information. Second, schedule a pulmonary function test. This simple breathing test measures how well your lungs are working. It's non-invasive, takes about 30 minutes, and gives you baseline data. Third, be honest with your doctor about your history. Did you smoke? Work around chemicals, dust, or fumes? Have repeated respiratory infections? These details matter. Fourth, don't wait for symptoms to get worse. The time to act is now, while your lungs still have reserve capacity and treatment options are most effective. This isn't about curing disease. It's about preventing problems from becoming serious. Smart, proactive health management based on what your body is already telling you. Your lungs are working for you right now. They've taken about 200 breaths since you started watching this video, but they can't speak in words. They speak in symptoms, and morning breathing problems are their loudest cry for attention. If this video opened your eyes to something you've been ignoring, do 2 things. First, type yes in the comments below. Let me know you're taking your lung health seriously. Second, share this video with someone you care about, your parents, your siblings, your friends. The people we love don't always recognize these symptoms in themselves. And if you want more research-backed health information, subscribe to this channel and turn on notifications. Your health is your wealth, and your lungs are the foundation of everything else. Take care of them.